Sir, it's great to have you here, and I want to get your reaction to this from the Washington Post in its article, and says in which a 2008 Obama campaign health advisor puts the website rollout this way. They were running the biggest startup in the world, and they didn't have anyone who had run a startup or even run a small business or a business. It's very hard to think of a situation where the people best at getting legislation passed are best at implementing it. So, sir, the rollout is being panned daily, and we have seen Dr. Zeke Emanuel out there trying to defend it today, saying that this is a long game on Morning Joe, that this is a marathon for the social contract of our country. However, some see it at this moment as a sprint, and you and the Democrats are failing. So with these new numbers out about millions losing their insurance, how do you get better control of the narrative that Obamacare isn't the Titanic?
Well, I think that the rollout has certainly been fouled up without question. Why, we'll find out in the fullness of time. But that won't matter in the long run. What will matter is, do people in the end get good insurance that's cheaper than what they have? And I think most people will. Remember that all these things we're seeing now, all the hype about millions of people facing cancellation of insurance, these policies, many of which have $10,000 or $25,000 deductibles, many of which don't cover drugs and other things, are being canceled because they don't meet the basic requirements. But most of these people, probably 9/10 of them, will be able to get much better policies more cheaply on the exchanges. So that they'll have better policies more cheaply. Now, they don't see that yet because they don't see the exchange yet, but within a couple of months, they should see that, and people should be well served. And also remember that we're talking here about 5 to 6, a subset of 5 to 6% of the people, because most people get their insurance from Medicare, Medicaid, right, their employers or the Veterans Administration. None of that is affected. We're talking about the individual market.
But this 5% still needs to be represented, not marginalized by this. But let me just ask you, though, why aren't you and your colleagues leading?
But those 5%, 90% of them will have much better insurance for cheaper than they're getting it now.
Absolutely, but they do not have that understanding yet, because the private insurance companies, they're not really helping in all this. And let me just show the headlines, sir, to everybody, because we've got how the narratives are fighting out on the front pages here. And headlines out today, the New York Times is pointing out that millions are eligible for free policies under the CARE Act, but insurers are reluctant to push the option because of a costly trade-off. Ezra Klein estimates as many as 7 million uninsured people may be eligible for those bronze health plans that are free after the subsidy. And then we have Talking Points memo. It's on a special investigation into the links that the insurers are going to hide Obamacare benefits from its customers, and even in certain states pressuring them to choose these new plans before the October 1st open enrollment date. So how do you encourage the insurance companies to recognize that they're now tapping into millions of new customers, and to recognize that this is a good thing if everybody can just figure out how it works?
Well, the insurance companies understand that they're tapping into millions of new customers. That's why the mandate was put in order to enable them to give, to insure everybody, including those with pre-existing conditions, without increasing people's rates. Unfortunately, there are unscrupulous people in insurance companies, not all of them obviously, but enough of them, to be doing what they can to fool people, to get them to sign on to expensive policies they don't need. Now, that's mostly a matter of state regulation. Some states have the ability under law to prohibit it, to fine them, to stop them, and Kentucky is doing that. Other states don't and should get that capability. Now, if we were operating in a normal environment, that is where the Republicans as well as the Democrats were trying to make the law work instead of trying to destroy it, we would pass a bill in Congress quickly that gave the federal government the ability to make sure that insurance companies didn't mislead their customers, and that if they did, they were severely sanctioned and fined for it, and that the proper information was given to people. Instead, we have Republican governors and legislatures doing everything they can to sabotage the navigators and others giving out correct information.
Right. The onus has been put on the federal government to get the website exchanges up and running.
Not just to get the website exchanges up and running, but to give out all the information, because a lot of the states aren't doing it.
But as we see in so many of these red states, there has been obstruction to getting the exchanges up and running. In certain states where the exchanges are running, we have seen success in Maryland and also in Kentucky. But we continue to kind of push through this thing together. We're going to let you go, sir. New York Congressman Gerald Nadler, thanks so much.